social distancing, flattening the curve, and self-quarantine. But one important phrase that might be here to stay is telehealth. Joining us now to discuss, CEO of Remote Healthcare Solutions, Adam Hardage. Adam, thank you for coming back on the program with us. Telehealth, telemedicine, now an indicator of how the American health system might change. Do you think that could be the case once we get through this?
Yes, I do, and thanks for having me on. Very simply, this is going to change the way that healthcare is delivered. And I know that when we set out as a business a few years ago, that was the exact goal that we had in mind, was to decrease some of the burden on in-hospital visits, decrease the risk of infection spread just even before coronavirus by keeping patients who may be suffering from a sickness in their home, whether it's flu or strep, or in the case of my 18-month-old son, he gets ear infections very regularly. So the ability to have remote medical care and have a doctor look in his ear with an otoscope and prescribe medication is great because it keeps him out of the hospital and keeps other people from spreading just even seasonal diseases, seasonal sicknesses.
And you're saying this is all through the computer screen. Now, some people might say, hey, it's not the same as going in to see my doctor. I feel like they might not fully understand exactly what I'm explaining to them, what my symptoms are, and so they could see it up close and personal. But what's your response to those criticisms?
Well, and as opposed to just a video visit, patients that work with us have something like this sent to their home where we can remotely monitor pulse oximetry, temperature, blood pressure, even glucose, pain levels. So we can take complete vital signs. We can also do a complete remote virtual exam using simple device peripherals like this temperature probe, or a finger pulse oximeter monitor, or a blood pressure cuff. So all those data points can get collected by our care team. And so we have a team of nurses and we have a team of doctors. If you look behind me, there's nobody in the office because we're all doing social distancing, and luckily we have a virtual company. So we could be spread around and everybody can still do their work. So all the patient, when they're in their home, they use that device, they take their vital signs, and then they check in with our care team, whether it's a nurse or a doctor. And we can see all of those results and trends over time via our web-based cloud portal. And so it allows us to do a complete virtual exam, no different than as if you were in the office of the doctor. The only difference is they can't physically put their hands on you.
Wow. So perfectly ideal for a time that we're in right now. Adam, can you tell me how your company's been adjusting to patients who might say, hey, maybe I've got coronavirus? Can you tell me, if you could diagnose that or not?
Yes, absolutely. We can certainly help with the diagnostics. I mean, the big three symptoms that we're seeing are obviously the cough, the fever, and shortness of breath. Well, we can monitor all those both qualitatively and quantitatively with the devices that we put in patients' homes. But beyond that, I think the way to be looking at this is, this is, as we say, it's the new MasterCard. You don't leave home without it. So forgetting even coronavirus, if my son has an ear infection and I don't want him to be exposed to someone who does have some kind of infection, let's say in an ER that is seeing COVID patients or has people on ventilators in an ICU, then I want to keep my kid out of that situation. And the best way to do that is with telemedicine and telehealth. So I cannot, support the industry enough. I think it's fantastic. It's certainly been a game changer for my family, for our network, and for the people that work for our company, because we're able to rapidly, on the day that my kid has, or my daughter gets strep throat, within an hour of her starting to exhibit those symptoms and looking in her throat with an otoscope, and then we can prescribe medication to her and get her on either antibiotics or antivirals or whatever the disease profile calls for. And it's frankly just a game changer for families. I think every family around America should be looking at it and saying, how do I get this kind of technology? Not just a video visit, but real technology, a real capability to have a device in my home that allows my doctor to confidently remotely diagnose, not just say, okay, you look like X, Y, or Z, but to quantitatively define it with real peripherals.
Yeah, I'm sure your patients really appreciate the quick response that you're able to give them. That's Adam Hardage, CEO of Remote Healthcare Solutions. Adam, thanks so much.
Still ahead on National Report, with the influx of COVID-19.